Good afternoon and welcome to the Canadian Housing and Renewal Association's webinar, Ending Chronic Homelessness. Today is World Homeless Day, a day meant to draw attention to the needs of homeless people in our communities and the actions required to solve Canada's housing crisis and to end homelessness. Today we get to hear about communities in Canada that are working together to end chronic homelessness. My name is Dominika Krzeminska, and I'm the Director of Programs and Strategic Initiatives at CHRA. I'll be your host for today. Thank you all for joining us. So moving on to today's webinar topic. Built for Zero Canada includes 33 communities from 7 provinces and 1 territory who are working together to create a sense of urgency, optimize local homeless systems, accelerate the adoption of proven practices, and drive continuous improvement. Today we will hear from 3 Built for Zero Canada communities who have made measurable reductions in chronic homelessness. I now have the pleasure of introducing to you our speakers for today. Marie Morrison is a dynamic veteran leader and innovator with over 20 years of experience in housing and homelessness. In 2017, she joined the Canadian Alliance to End Homelessness as the director of the 20,000 Homes campaign, which is now Built for Zero Canada. Lori Richer is the Housing Stability Manager for Wellington County Social Services and Built for Zero lead for the Guelph-Wellington-Community. Lori and her team deliver federal, provincial, and local funding to homeless system providers and homelessness prevention programs, in addition to collaborating with community partners to improve the homeless serving system for the City of Guelph and the County of Wellington. Michelle Corley has held various housing-specific roles over the past 15 years in the Human Services Department at the City of Kawartha Lakes. She's an accredited member of the Institute of Housing Management. Michelle's current role as program supervisor has her overseeing the social housing program administration, as well as housing help and homelessness services for the regional area of Kawartha Lakes and the County of Haliburton. Emily Dietrich is a facilitative leader, educator, and change maker with 15 years of experience building capacity for healthy and strong communities. Emily joined Homeward Trust in February 2019 as the Chief Programs Officer. Her department includes all Housing First programs, including coordinated access, youth programs, clinical and high-intensity programs, landlord relations, and permanent supportive housing. Welcome to everyone. I'm going to pass on the controls to Marie.
Really excited to be here, and I'm going to start us off by providing a bit of an overview around what Built for Zero is all about, and then I'm going to do that quite quickly. The presentation is available for download now and is going to be sent out afterwards, so you can access some of the embedded links and videos and things that are available that I won't be showing, so that we can quickly move to hear more from the communities that are involved in the campaign. So you may have heard us referred to previously as the 20,000 Homes campaign, working to house 20,000 of the most vulnerable people across Canada. Starting in June of 2015, and we reached that goal by February of 2019 with 38 communities reporting 21,254 people housed. And then in March, we relaunched as Built for Zero Canada, and there's more information about that there in the links that are included. So Built for Zero Canada is an ambitious national change effort helping a core group of leading communities end chronic homelessness. But we know that it doesn't end there. It's really the first step on a path to eliminating all homelessness in Canada. And if you want to see a little bit more about Built for Zero, I've linked in a video there. I would also want to share that we are funded in part by the Government of Canada through the Community Capacity and Innovation stream of Reaching Home, Canada's homelessness strategy. So when we say end chronic homelessness, we are measuring a functional end to chronic homelessness, which we have defined as having 3 or less people experiencing chronic homelessness in your community for 3 consecutive months, and then of course working to sustain that. If you want to know a little bit more about what we mean by functional zero, how we're defining homelessness and chronic homelessness, you can get that in the functional zero Q&A document that's linked in. And if you want to learn a bit more about binding lists and how that helps measure the functional end to chronic homelessness, you can link on that 4-minute animated video that's included as well. So we know that it's possible to get there because of some of our learning and our work with Community Solutions in the US, who runs the Built for Zero campaign down there. They have had 10 communities functionally end veterans homelessness, 3 end chronic homelessness. They have 74 communities with a quality by name list, so having that real-time data to measure their progress, and 39 of those communities have achieved measurable reductions in active homeless numbers. They've housed over 100,000 folks, and they have had, for those communities that have reached functional zero at any given time, 60 to 90% of those communities are sustaining that goal. So they continue to measure after they reach to make sure they're sustaining. If you want to know more about the initiatives and the learning from that campaign over the last 3 years, I've linked in the report there if you want to learn more. So in Canada, as mentioned, we have 33 communities that are currently participating, that are included in the map there. And this is from our website, bfzcanada.ca. You can always check on what's going on with the campaign under Track Our Progress. A map and a list of the communities is there. We also have individual community progress along the milestones and campaign progress overall. So this is what the community progress page looks like. So communities are listed by province and they drop down, and then you can see where communities are at, again, along the milestones. And for those that have reached a quality by name list, there is a link to their data dashboard, so public data on how they're progressing on reducing active chronic homelessness. Overall, in the campaign, we have 11 communities that have achieved quality real-time data through a quality by name list, and we have 3 communities that have reduced chronic homelessness by 10% and held that for 3 or more months. And we have more that are getting close there, both to a by name list and to reductions. We have a couple communities that are getting close to functional zero. So I encourage you to stay tuned on progress. So these communities really serve as a peer network, supporting and learning from one another to do the challenging work of ending chronic homelessness. And we've also rallied around partners to support the campaign and these communities in their work as well. Communities come together twice a year for learning sessions where they bring a team and they plan what they are going to be trying to accomplish in the next short action cycle. So they come together for a learning session that's followed by an action cycle. They come back for a learning session. We started this, we piloted it in the US before it came to Canada in November of 2018. And then you can see we've had a series of both in-person and virtual learning sessions and action cycles. The milestones that communities are working on include the ones you see here. So we organize communities into the cohort, into a cohort based on where they're at in their progress. So folks start in the by name list cohort where they are working to get a quality by name list by scoring 11 out of 11 on the by name list scorecard, getting 3 months of reliable system level by name list data, and then setting a baseline from which to measure reductions. Then they would move into the reduce cohort where they are working on coordinated access and system improvements to derive monthly reductions and get to the home stretch where we're predicting that they're a year or less away from reaching functional zero. Once folks have reached functional zero, we're working to confirm that and support them to sustain zero and then look to expand to new populations. We know that all the communities throughout all of these cohorts are going to be continuously working on leadership, building their local team, and building local will for ending homelessness. So they have communities and have a variety of tools that are available on our public website. These are available to everyone across Canada. So under campaign resources, there are links to webinars and a video library with over 100 videos. There's a whole page of information and tools and support, and the by name list scorecard on the by name list page. Same thing on the coordinated access page, lots of community examples and links to resources in the coordinated access scorecard. Program areas a variety of resources around diversion, shelter, street outreach, housing with support, working with system partners. And then just recently updated was added the Registry Week Toolkit. So anyone who is looking to pair a Registry Week to kickstart their by name list along with their PIT count next year, there's some tools and resources there. Communities are working on developing skills and behaviors for solving complex problems, because we know homelessness is a complex problem that is not going to be solved by technical or static interventions alone, that we really need to have a problem-solving toolkit that can flex as the problem evolves. And there's a great video linked there that I really encourage you to watch if you haven't seen it. It's about 3 minutes long, talking about how homelessness and ending homelessness is more like birds than baseballs. So communities are working on data analytics, human-centered design, quality improvement, and facilitation and meeting design. And we use the model for improvement for that quality improvement work, borrowed from the Institute for Healthcare Improvement in the US, where communities are really focusing on both long-term and short-term aims about what they're trying to accomplish, having measurements to know whether a change that they're making is an improvement, and then thinking of innovative change ideas, small ones that they can test through the Plan, Do, Study, Act cycle, or PDSA. So communities are undertaking PDSAs, small tests of change, to test if they can move the needle towards the aim that they're trying to achieve, which in this case is ending chronic homelessness. We find that communities who join the campaign come with a set of mindsets and are continually working to develop these mindsets as well, including a bias for action, fail forward, growth mindset, abundance not scarcity, and mission focused. I won't go into more detail there, but certainly you can follow up and have more of a look at that. So that was the introduction to Built for Zero, setting up our 3 wonderful speakers. So I will be turning it over to them. We're going to be starting with Guelph-Wellington and then Kawartha-Haliburton and wrapping up with Edmonton. So Lori, I'm going to set you up for your slides if you want to unmute yourself.
Thanks, Marie, and thank you everyone for having me on the call today. One of the first things that I was going to do was just a little bit of background information about our community. Guelph-Wellington is a mid-sized community located in the heart of southwestern Ontario. We're definitely in proximity to vital transportation corridors and about an hour's drive to Toronto. The area encompasses 2,661 square kilometers of land and is comprised of 8 municipalities: Centre Wellington, Erin, Guelph, Guelph-Armasa, Mapleton, Minto, Puss-Lynch, and Wellington North. According to the 2016 census, our total population for our service area was just a little under 223,000, and over half of the population lives within the city of Guelph, about 59%, and the remainder of the population lives in small urban centers and rural areas throughout Wellington County. Next, thanks, Marie. The County of Wellington is the consolidated municipal service manager for the County of Wellington and the City of Guelph, and we're responsible for the delivery, system planning, and administration of provincially mandated social and affordable housing programs, as well as provincial and federal initiatives to prevent and address homelessness. This includes working across the entire housing continuum, from emergency shelters, transitional housing, supportive housing, improving the sustainability of the social housing stock, creating new affordable rental units, providing rent supports and market rent, and assisting with grants or loans to purchase or repair a home. And I thought it might be helpful to talk a little bit about our emergency shelters. So the County of Wellington funds emergency shelters located in the city of Guelph that serve both the Guelph and Wellington area. The emergency shelters in Guelph serve youth, adult men, women, single, and families. And we also have a coordinated entry system where individuals experiencing homelessness in Guelph-Wellington are prioritized for service. In terms of our emergency shelter beds, we have about 52 beds in our total capacity. At our youth shelter that's run by Wyndham House, we have 14 beds. Our single male shelter at Stepping Stones has 22 beds. And mothers with children or single women, we have Dwelling Place with 16 beds. Overall, we have to use motels for any sort of shelter overflow for larger size families. And on a typical night, we have about 53 people that stay in shelter per night, which is about 40% decrease from 2012 when the average was 88 individuals staying in shelter per night. In terms of our connections to housing, the County of Wellington owns and operates, we have 1,189 units of rent geared to income, housing in 31 properties across our area. We also work with housing providers who own and operate 1,111 units of rent geared to income housing in 29 properties in Guelph-Wellington. And then we also use federal, provincial, and municipal funding to support 255 households with rent geared to income in market units. So that makes up that 2,555 number of rent geared to income housing. The majority of these units are filled by the centralized wait list, which is a chronological wait list that can take anywhere from 3 to 5 years for a unit. It really depends on the family size. And in the bottom right-hand corner, you can see that our centralized wait list continues to grow. By the second quarter of this year, the total number of households on the wait list for housing had reached 2,056, which is the first time it has risen above 2,000 households since 2003. When we look at homelessness, one of the barriers that we identified for individuals that were on our by name list was that they weren't on the centralized wait list or were sometimes having their application canceled for not completing their annual update. And we've done a lot of work with our service providers to try to ensure people are filling out the application to be on the wait list for housing. And we also have done some work on ensuring that annual updates are being completed internally, leading to a reduction in those canceled applications. We also were able to, in 2018, we added homelessness as a local priority for housing, and it's based on a 1 to 10 unit ratio that people are prioritized through our by name list. In Guelph-Wellington, we have 303 affordable housing units. I'm not going to go through a lot of detail with that, but I do think it's important to see in the bottom left-hand corner, you can see the timeline for when units have been developed. Some of them we directly own and operate, and some of them we also have helped with partners in our area to develop those affordable housing. And then we also offer 103 rent supports throughout various programs to improve housing choice and affordability in the private market for individuals in our area. And there's a small portion of those particular rent supports that are tied to our Housing First program and that are able to help support people on Housing First and our by name list. Next slide, Marie. And taking a little look at our data, our coordinated entry system began in February 2017, helping us track who was experiencing homelessness in our community. In the beginning, surveys were being completed primarily by our shelter providers and required constant engagement with other service providers to participate on a consistent basis. The increased engagement from the other service providers and a completion of a point-in-time count in April 2018 led to a steep increase in the number of individuals on our by name list. In 2018 and the beginning of 2019, our inflow each month was higher than our outflow. We were just seeing more people coming into homelessness than we were able to find housing placements for. We've really been working hard to understand the data that comes out of our by name list and use it to implement small tests of change and to be able to evaluate them. From September 2018 to March 2019, we have seen a 24% reduction in the individuals on our by name list, which is a great thing for us to be seeing in our community. So what got us here? Can we have the next slide? Thanks, Marie. Participating in the 20,000 Homes campaign, which is now the Built for Zero Canada, has changed the way service providers in our community work together to respond to homelessness, moving from a silo approach to one of collaboration and a no wrong door approach. Our work would not be possible without a community shift in focus towards ending chronic homelessness, which requires continued collaboration and integration of services to achieve this goal. We continue to engage with service providers in our community to shift the system to one that we share a common vision that is housing focused. Everyone who is homeless in our community is on our by name list. Everyone has access to resources for housing stabilization. We have a common voice to advocate for supportive housing. supports and resources to act in response to shifting needs. One of the key pieces to all of this is really our shelter providers. They have really shifted to a common vision that is housing focused and align their supports and resources to act in response to community needs. Can we get the next slide, Marie? They are actively participating in our Built for Zero action cycles. They're helping to identify service gaps, potential resources, and recommending projects to improve services. They invited Ian De Jong from Orco to evaluate current service model and are working on implementing his recommendations. They've also come up with some creative solutions to identify housing stock. One example is Wyndham House, our youth shelter provider, is working in partnership with Family and Children's Services to do head leases on securing units and to be able to support the youth that are in there. And we also had a building that a lot of people would not typically rent to in our area, and they were approached by our adult shelter system, and work is underway to provide additional support to people in that building and to also align with our Housing First. We've been able to place people in that building. So they're really kind of working outside of the box and looking for solutions to our current housing stock issues that we have in our community. In terms of real-time data, it's driving our decision-making and ongoing system change. When we look at our by name list, one of the key things that we recognized was that our inflow was much higher than our outflow. We were having more people come into homelessness, and we were able to, earlier this year, add 2 diversion and rapid rehousing staff to help with homelessness prevention work in our community. We've also looked at making exceptions. We provide last month's rent to individuals or rental arrears funding when needed, and we've been making some exceptions when we believe that it is helping individuals that are homeless get housed, or it is helping people that are at risk of housing to stay housed. We've also improved support for our active homeless, so really seeing the need to increase our Housing First staff. We originally started with our pilot with 1 housing staff, and we now have 4 Housing First staff working across the youth and the adult system. We're seeing shifting existing resources with all of our service providers to meet current community needs. So where are some of the gaps that we have and how can we fill those? And it's also providing us overall with a greater understanding of our system outflow and our community needs. And one of the things that we were able to do is create a new supportive housing partnership with Stonehenge, who is our addiction support, and also with the Local Health and Integration Network. And we've been able to provide supportive housing for individuals that are experiencing mental health and addiction issues in our community. We also know that it shows that we have a need for increased housing supply, both supportive and affordable. Those are two barriers that our community really faces right now, and we are actively working with our partners to see how we can help resolve those. In terms of leaning into challenges, we are definitely seeing measurable reductions in the number of homeless people in our community, and we will continue to drive towards ending chronic homelessness. A couple key areas that we need to work on is increasing our housing supply. I believe I just mentioned that with both supportive and affordable housing. Also looking at waitlist coordination among housing providers. We know that we have some supportive housing providers in our area. They're all using different wait lists. How can we work together to ensure that we are using a similar list or similar criteria to help move people into housing? And also looking at being discharged into homelessness from institutions. So how can we work together with our hospitals, our treatment centers in our area, and corrections to be able to ensure there's a good plan for individuals leaving those institutions and be able to have them housed when they're leaving there. And that's it for me, Marie.
Amazing. Thank you, Lori. So Lori was noting that they are the first mid-sized community to get that below baseline milestone. So that was great work, and just continuing on with a 24% reduction. So thank you, Lori, very much. We encourage you to type in questions if you do have questions specifically about Lori's presentation, but we're going to move on to Kawartha-Haliburton. So I will turn it over to Michelle.
Thanks, Marie, and thanks everyone for the opportunity to speak today. I'll give you some background on Kawartha Lakes and Haliburton. So our region is just over 7,000 square kilometers in the heart of southern Ontario. We have about just over 93,000 residents. There's a huge influx of seasonal residents, especially in Haliburton in the summer, but we really don't find any correlation between that and our homelessness work. Lindsay is our largest urban center with a population of about 20,000, and Lindsay itself is about 2 hours from Toronto. To give you some other geographical context for those who are familiar with Ontario, the southern tip of our region borders Durham region, with the northern tip falling into a portion of Algonquin Park. Next slide, Marie. Thanks. So the City of Kawartha Lakes is the consolidated service manager for both the City of Kawartha Lakes and the County of Haliburton. So at our office, our Human Services Office, we're the ones legislated to provide housing and social services to both of these municipalities. Our homelessness program administration, like I said, is managed from the City of Kawartha Lakes Housing Services, Human Services Department. And our local response steering committee is the governing body that approves any changes to a coordinated entry system framework. And this is a group of individuals, typically executive directors from agencies who are also working with individuals facing homelessness in our community. So they come together and we collectively can agree upon what our community policy and practice should be for homelessness response. And we should note, too, that we're not a Reaching Home designated community, so we don't receive any ongoing regular federal dollars to support our work. And really, most of the funding that does support our work currently does come from provincial homelessness prevention funds, as well as provincial funding. To give you an idea of our system of care, we have one emergency shelter with a 19-bed capacity. And that emergency shelter is located in Lindsay. So it is noteworthy to mention that for some individuals, getting access to that shelter is actually a 2-hour commute. So it is, we're limited that way, but at the same time, we do see other areas of our community who become naturally very resourceful with dealing with homelessness because we do have a lack of emergency shelters. We have one agency who is contracted to offer intensive case management services within our Housing First program. It is the local addiction treatment agency, but they now have a separate focus in their organization to just really focus on recovery from homelessness. And right now they have some funding that can support up to 45 individuals in that Housing First program. There's two other agencies who offer case management support and support individuals in designated units that can support up to 40 individuals. And our homelessness prevention supports are offered through our municipally operated Housing Help office. So individuals come to our office for numerous reasons to apply for social assistance through the Ontario Works program, but at the same time, they can also speak to individuals at our office about our centralized waiting list for community housing, and they can also access a wide variety of homelessness prevention supports through our Housing Help division. And the city currently also funds 2 transitional housing programs. And similar to Guelph-Wellington, we have also engaged ORCODE Consulting to perform a homelessness system review, and that has been now completed. And we're actually starting later this month, we're working to implement some of the recommendations within the report. So we look forward to kind of seeking some additional opportunities to have some changes made to our system to even better support individuals facing homelessness. So connections to housing, and specifically community housing. Community housing has become our primary source for housing those individuals into our Housing First program units. Right now, altogether, we have the capacity of 74 units that are either market rent or affordable housing units that aren't connected to the centralized waiting list for community housing. But if units designated through this referral agreement come up for vacancy, then individuals from our homeless by name list are placed into those units. And really a key piece here to identify those specific units is through, as I mentioned briefly, is that referral agreement. And that referral agreement has been pretty beneficial to us. It outlines a lot of the expectations for the service provider, as well as the landlord around ideas and process steps to housing people into those units. But then there's commitments made for ongoing collaboration between the support agency and the landlord, and obviously outlines expectations around support for the individuals themselves. Rents, since we don't receive tons of, outside funding to support these units, we're predominantly using municipal funding to subsidize these units. So they're subsidized through a municipal portable housing benefit or a municipal rent supplement. And then we do have some units that are funded through a Ministry of Health rent supplement through an agency who receives funding from our local LIN. And we do have a few of those units receiving some of that funding. But generally speaking, all individuals receiving some sort of top-up are typically not paying more than 30% of their income towards the rent. And then supports, they are typically funded by provincial homelessness prevention funding or by, again, the Ministry of Health programs. I just wanted to take a moment and kind of highlight a recent initiative of ours, actually starting in June and then full occupancy was later in August, was our very new initiative of building a 24-unit complex where we have housed individuals exclusively from our homelessness by name list. This building offers permanent supportive housing to individuals who are then housed into 24 one-bedroom self-contained units. There is on-site support staff that's made up of 2 intensive case managers and 3 housing support workers who work 5 to 7 days a week supporting these individuals. Each unit, as I mentioned, is filled from the by name list, but specifically for this site, we've actually housed the individuals with the most complex needs in our community. The capital cost to construct this building came from a variety of federal provincial funding initiatives. There was actually 4 blocks of funding we pieced together to make this building happen. And I should note too that this building is actually a wing of our brand new Human Services office. So we do have our office space connected to the far side of that building. Ongoing support funding for this building has been secured from a provincial program. And the rent model for this building is quite unique, and it's actually been designed through the operating budget to offer naturally low rents. So there is no subsidies at the site. Individuals, if they're in receipt of social assistance, their rents are equivalent to max shelter allowances connected to those programs. Otherwise, individuals are paying, again, a rent equivalent to 30% of their income. So prior to this site, a lot of our housing that we've embedded in our community housing projects and communities have been done through a scattered model. And now this is our first model where all 24 households are actively participating in our Housing First program. So just to go over our data, just to touch upon some things that our data is illustrating, some noteworthy things to mention is the drop and decline of chronic households between November and December of last year. That was largely due to a significant cleanup of our data, ensuring that we went out to several partners to obtain updates on individuals. We found out a lot of individuals successfully housed themselves on their own, or they have left the area. So we, started identifying at that point some better processes to do those updates on an ongoing basis. And then we see later on, between February and then May of 2019, an increase of chronic households, and largely that's due to a success of us doing community training and outreach to community partners to help them understand what we're trying to achieve through coordinated entry and encouraging them through training and providing them the resources to then identify and help us to add individuals experiencing homelessness to our by name list. And then, as I mentioned previously, we were busy filling those new 24 units starting at the end of June and then into August. So we're then seeing a drop in our numbers at that point. And again, a lot of the work through Built for Zero, there is a lot of attention and priority put towards process improvement, and some things we're currently also working on is diversion pilot, just to see if that's something we can then expand to have all of our community partners who serve those facing homelessness actively participate in homelessness diversion. So how we got here, so in 2016, in May of 2016, we joined the 20,000 Homes initiative, and also in 2016, we voluntarily did our first registry week, which helped us jumpstart our work around homelessness response and coordinated entry. Once we had those names in 2016, we had to act upon it. We really sit in there with a lot of accountability to do something about those individuals that we've now identified through that initiative. So from that point, we then started working at implementing coordinated entry. And really, ultimately, we wanted to do all this work because we needed to deepen our understanding of local homelessness, and we wanted to have that person-specific housing and understand the support needs of those individuals that we now knew by name. So it was really important for us to know this information, as we really didn't have good opportunities prior to this to have this information, especially with us just having a single emergency shelter being located so far away from other parts of our community. We knew that homelessness was predominantly hidden, and we needed an opportunity to try to actually quantify that. So so it's been a great initiative for us to be a part of, and we have enjoyed working with the partners at 20,000 Homes and now Built for Zero to get some of this work accomplished. So another quick thing I'll just quickly touch upon is the opportunity that we have every other week in our community where we get together, and through a consent-based case conference mechanism, we do meet with our homeless serving partners. Typically it is frontline staff with some supervisors at the table, and we're going over individuals who have scored quite high and are new to our by name list. We just taken a moment where we try to do some case conferencing and collectively put our minds together to kind of come up with creative approaches to remove the barriers that these folks are facing around housing. It's provided us an opportunity to really see some collective impact, and has certainly done great things around community capacity building for us. Next slide, Marie. Thank you. And then specifically talking about our partners, again, probably our biggest partner for housing is Kawartha-Haliburton Housing Corporation. So this is what's known as through legislation as our local housing corporation. So the city of Kawartha Lakes is KLHHC's sole shareholder, and it is operated by City of Kawartha Lakes staff. So because there is such a close relationship, the single leader of our municipal social housing and other housing projects is also the CEO for this organization. So she's able to kind of see the needs on both sides of the spectrum, and has been willing to, open up some of the units through this organization to house some of the individuals from our by name list. So that close relationship has paid off huge for us, and it's been a great opportunity to kind of provide us that inventory of housing that otherwise we would have really struggled to have in the private market. So KLH too, I should also know, is really active in developing new projects, and actually really active specifically in redevelopment and regeneration. So they're actually working on their 6th regeneration project at the moment. It's in pre-consultation and pre-development stages at the moment. But every time they've been opening up a new community through a regeneration project, we've been able to obtain a couple of the units for our Housing First program. So that's been great. And it's great to have such a close partner, and great to have a partner so close to that's such an active developer and providing us with new housing stock. So our challenges, we certainly have challenges. Wouldn't be right to not say that, but they're things that we overcome all the time and every day. And looking back, it does encourage you to keep going because we have come so far. Continued engagement is something that we face, but it's certainly not unique to just our community. We've tried to ensure we have commitment of our partners by the signing of a memorandum of understanding with these partners, which outlines some of the expectations that we have with that agency as far as them participating in coordinated entry around homelessness response. So there's accountability there when things within an MOU aren't being followed. And it's been an opportunity to just connect more with those agencies, and the collective impact is so important. And I think more and more partners are seeing this every day. Our rural outreach, with us having such a large geographical area and so much of it being very rural, so almost portions of it I would consider as remote. Rural outreach is a challenge, and we have to get quite creative sometimes of how we tackle that. So there are opportunities we still have to formalize some of those approaches, but sometimes our biggest opportunities to achieving outreach have become from opportunities that have just kind of come out of the woodwork and have required some creative opportunities to solve. But again, we work through those challenges as they come up. And then obtaining updates on those in the by name list. So we don't use HIFIS, but we have found ways to make sure our information is shared with our partners, and we make it as real time as possible. And we're continually working on improving that process so that there is greater access to that information for our partners. And I think that's everything for me.
That's great. Thanks so much, Michelle. I am going to just give some late breaking news. I think yesterday you just reported a couple of more months of data to us, and we're going to be confirming it, but you will probably be the fourth added onto the list to be below baseline in terms of reduction in chronic homelessness, that next milestone. So sort of an early congratulations and kind of late breaking news on the website today, but you would be the second more rural-based community that has had measurable reductions.
Oh, that's great.
So going to turn it over to Edmonton, and Edmonton is our first large community to reach the below baseline milestone, and super excited to have Emily Dietrich from Homeward Trust presenting, and I'll turn it over to you.
Thanks very much. So thanks for having me, everyone. Usually I like to take questions during a presentation, but I know this format doesn't support that, so happy to answer any questions at the end. A little bit about our city, Edmonton. Edmonton is one of the two largest cities in Alberta. It's basically in the middle of the province. There's 62% of the province that's above it, but there's not much in the rest of that part of the province. So it's our farthest northern one. It's also the capital city. With Edmonton, that what kind of makes it unique in terms of our context and our work, in addition to what's on the slide that you can all see, is that we are surrounded by several different penitentiaries and institutions that have a direct feed into Edmonton. And we're also the gateway to the north in terms of services, and also in terms of a jumping off point for industry. So that's just a little bit about Edmonton. Next slide about Homeward Trust. When we're looking at the Homeward Trust role, it's, for me, I've been with the organization about 7 months, and it's a really big organization that has lots of different responsibilities. I'll do my best to explain it. We have a system planning role as designated by the municipal government, and also we are the community-based organization for Alberta in the Plan to End Homelessness for local implementation. Moreover, with Reaching Home, we're designated as the community entity. So I'll talk a little bit more about that in a minute, but some of the things that we do is we're an aggregator of different levels of government's funds, and we mix those all together in order to fund a number of programs and partners in our city. So there's 15 program types, but we have 55 different programs delivering in those types, and with about 16 to 20 partners. We also manage the homeless management information system, we use ETO. And so that's for all of our partners. We have a coordinated access system, which has 60 different access points around the city. And Homeward Trust has many different parts to it. Of course, we have the parts that you're likely more familiar with, which is our Housing First programs and our coordinated access system. But we also have a number of properties that we own, and we develop properties as well. So there's that arm and some subsidiaries that do that. And we also have a social enterprise called Find, which feeds into our Housing First programs, where people that are getting set up in housing can have access to furniture. So that's a little bit about us. If we go to the next slide, we acknowledge that there's many players in ending homelessness, and really it's a challenge that requires community collaboration, system planning, and a really strong commitment to move people out of chronic homelessness into stable housing. We know that to do that, we need to be offering a number of different kinds of programs. So that's on the far left of the circle there in gray. So we talk about programs on a continuum on intensity, where on one side of the spectrum, you have programs that are lighter touch intensity, such as supported referrals, which gives first and last month's rent and a Find furniture pickup. And then on the other side of the far end, intensive case management and permanent supportive housing, where you're offering more intensive supports to people to help them retain their housing. Our work frequently, obviously, we plug into Child and Family Services, Alberta Health Services, Alberta Supports, and of course all the community organizations that support this work. So it's a really important way we do our work, which I'm sure many people here can relate to. If you look at the next slide, we're funded partly through the Federal Reaching Home program. And as such, Homeward Trust Administration and our board of directors and the committees that are described on the slide make up our community entity and our CAB, our Community Advisory Board. So this means that all of our decisions as it relates to program investment and system planning are run through these different committees to the end to make sure that we are representing what the community needs and wants. And there's a real accountability structure as it relates to that. Next slide, I mentioned the housing development and an overview of what we do. Between 2001 and 2016, we had a number of capital projects, and what we're really excited about right now is we are working very closely with different levels of government to position Edmonton to add 900 units of new permanent supportive housing sites to our inventory. And so there have been 4 sites that have been identified right away, and we're just working with different levels of government to orchestrate that, and it's super exciting because there's a lot happening in the permanent supportive housing space. The reason we're excited about that is when you look at our by names list, there's approximately 150 people on the by names list that need more clinical and high intensity supports that PSH can provide. And then our intensive case management program, which is a 1-year program for people after they've been housed to help them retain their housing. If we look at that, we have a number of people in that program that are actually staying in the program for more than a year and are receiving what we call a number of red flag efforts, which is evictions, inappropriate uses of emergency, or interactions with the social justice system. And so we know that we need more intensive supports for those folks to help them retain their housing. And so this investment in permanent supportive housing is very exciting. So the next slide was a bit of a light bulb moment for me in terms of understanding how our organization works, and actually, frankly, sometimes how complicated it is to explain to others. So on the far left, you can see the sources of our funding, making the shift: municipal funding, federal funding, and provincial funding. I think the magic of what Homeward Trust does is all the ribbons in the middle, is that we mix the funding together in a flexible way so that we can meet the needs of the community. And so you're seeing different kinds of programs that we fund and or operate. So connecting to long-term solutions, you have your homeless prevention, your housing supports, which is the programming that supports getting people housed or keeping them housed, and then moving on to outreach. So a little bit more about our programs in the next slide. At Homeward Trust, and we obviously know that investing in prevention and diversion is a really significant strategy to address the inflow into homelessness. And we are currently doing a diversion PDSA, so the Plan, Do, Study, Act cycle that was mentioned at the start of the webinar, which is really about, it's actually really about us understanding all the diversion work that's happening in the city. We know there's a lot of diversion work that is happening, but we want to formalize it a little bit more and to really understand how lighter touch services to help connect people to information, referrals, removing barriers, getting them an ID, working with landlords can really help people end their own experience of homelessness before it becomes a chronic thing. Our supported referral program is a low intensity program where we can just help people kind of get started, first and last month's rent, and find furniture pickup, and we do monthly check-ins with them. With the red box in the middle really talks about our coordinated access programming, and we're really excited obviously about having a really good coordinated access system. It can always be better, and we're working on our coordinated access version 2, but very pleased to have a program that has 60 different entry points. We have a number of 12 housing first teams across the city, and we have worked at really making sure that we're using our system and having the by names list and working people through 3 key process stages, which is 1, accessing the services. The next one is screening people to the right program that we have in our suite of programs, then prioritization, and then matching them to a team. And then on the far right, we have our clinical and high intensity programs. So there's a number of programs that we have made under the label clinical and high intensity. Part of those programs are permanent supported housing sites that we fund and operate. And so they offer a suite of services to keep people housed, on-site support services, including in-reach and outreach medical services. But we also have some really interesting programs that are not duplicated in the whole sector. So one would be our financial hub program, which helps people with managing their money. And it's a really great program for helping people when they have a barrier as it relates to managing their funds over the month, so they can have money for food and rent and those sorts of things. We also have our clinical access team that we fund through George Spady, and that's a program that's really focusing on bridging to mental health supports in our system so that people that are recently housed can work through the things that they need to work through that they self-identify with the clinical team that we fund, and then be also bridged or connected to other services within Alberta Health Services. We also fund our assertive community treatment team with Alberta Health Services, which really supports people that have a diagnosis on the Axis 1 spectrum. And we're actually looking at expanding that moving forward. So just looking at the suite of programs we have. The next slide describes some of our data. So since 2009, Edmonton has reduced chronic homelessness by 43%. We're working to end homelessness, chronic homelessness by 2020. We're very pleased to have had a 15% reduction since January 2018. And we really attribute this to a very clear focus on ending homelessness, strong community engagement. This would not be possible without all those different system players and the different teams that are out throughout the city. And data-driven decision-making, being able to collect data for the entire system and to understand how to use that data to drive performance. You'll notice the drop that occurred that I referenced, the 15%. We actually believe that's, of course, due to the hard work of all the people that I mentioned. However, we also know that it has a lot to do with really working the by names list in terms of making sure that the data is clean and that we're connecting with people regularly on the by names list and making sure we have a current snapshot of their situation. In reference to the next slide about what got us here, I believe I've mentioned some of these in the last slide. I think some things that have got us here, though, from the perspective of being someone relatively new to the organization, is there is a real bias towards action. So what can we do now? How can we track what we're doing now? And how can we use that to do better? And I think it's really exciting to see that kind of focus in the work that we do. And this wouldn't be possible without the relationships we have at all different levels in different organizations such as Edmonton Police Service, Alberta Health Services, Alberta Supports. Those are super, super important. We also have a Housing First Advisory Council, which is made up of sector leadership, EDs and CEOs of the agencies that we work with as partners to really help guide and focus our work. Next slide about leaning into challenges. So we have lots going on. You know, it was really challenging even to get to this webinar today, but we're so excited to be able to chat about what's happening. But we have had we have a very large river valley in Edmonton. For some of you that are not familiar with it, it's a huge amount of square foot of space. And the river valley this year was very wet, and also the city clamped down on enforcement in terms of people that were sleeping rough or people that were camping in the river valley. As such, those folks moved to the core, and we have a number of tents around the core, about 107 structures. And so we have actually convened in the last 2 weeks an encampment response team, which is a cross-sector team to respond to the camping in terms of bridging to not just housing supports, but healthcare, EPS, Edmonton Police Service, so that we can do a warrant diversion program, and also Alberta Supports, so we can get people access to income and help get them housed. So that's something that we're pleased to be working on in the context of having limited permanent supportive housing sites for people to go into. We are also working on a bridge housing strategy, which will help. This is all made possible by work with our partners. So we're really pleased to be working very closely with Edmonton Police Service and Alberta Supports. With Alberta Health Services, one of the other challenges we're looking at right now is how to design the in-reach and outreach medical services for the people that need permanent supportive housing in the for these new sites that we're bringing on. So those are some of our challenges and opportunities.
That's great. Thanks, Emily. I think that was your last slide. That was super exciting to hear what's happening, and even just really recently. And I think folks on the call can really hear from all three of these presentations, very action focused, very focused on their goals, really working at being coordinated in the community, and just a really scrappy group of people. So thank you, all of you, for sharing. And Dominique, I'll turn it back over to you to see if there are any questions.
Sure, thank you so much. Thank you to Marie, to Lori, Michelle, and Emily for the wonderful presentation. As people are, we'd ask now that you type in your questions, any questions that you have for any of the speakers specifically, or for just a general overall question, just type them in. And as you are doing that, I actually have a question for definitely for the three, for Emily, Michelle, and Lori, but Marie, feel free to answer this as well, because you've had a lot of experience with working with these communities. But what I'd like to ask is, and it's appropriate that we're on the leaning into challenges slide, is what's the #1 barrier that you've identified to ending chronic homelessness in your respective communities? And maybe we'll start with Emily.
So I had to unmute myself. So you said the #1 barrier to ending chronic homelessness?
Exactly.
Okay, so I think the #1 barrier is the complexity of the population that we're serving. And not necessarily having housing options for them that match their needs. So I'm sorry, I don't have the exact stat, most of the people on our by names list have indicated conditions of trimorbidity, so physical, mental, and addiction challenges. And so to keep them housed is very challenging, and that's also in the context of methamphetamine use and how challenging that makes it in our community when we're working with folks that are more vulnerable.
Great, thank you. Michelle, if you want to answer the same question.
Similar response from me also. Homelessness is predominantly an issue resulting from lack of housing, and these individuals certainly are experiencing that because of the challenges they experience. There's a lot of Opportunities for them aren't there to access private rental housing because of just being a small community and people know about them. So that creates barriers for them to access just the private market. And then as far as accessing traditional community housing, the waiting list is a huge barrier for these folks just because they're so transient. We, maintain that other waiting list, and we have seen these individuals looking back in history, they've applied and then we've lost track of them. So meeting them where they're at and finding housing opportunities that we can prioritize them into is probably the biggest need that we face with them.
Great, thank you, Michelle. And Lori?
I would have to echo the comments from both Emily and Michelle. I know that on our by name list, we have 75% of the individuals on our list score high acuity with trauma-related needs, and we don't have the housing that would fit their needs right now. And I think that's the biggest barrier: stock overall, access to stock, like Michelle said, and definitely the right type of housing stock.
Great. Thank you, Lori. Marie, did you want to respond to that question as well?
Yeah, I would add that I think, kind of across the board, communities would say a lack of affordable and supportive housing. Helchonsky would say that, homelessness is really just an extreme manifestation of poverty, and we have seen a 40% increase in rental costs across Canada in really just the last few years. So, I mean, that's made it extremely challenging, and then that results in a lot of complexity for the folks that have been left homelessness for longer periods of time. And so I think, these communities are examples of one who are saying, if that's the reality we're working within, how do we keep raising up that issue, showing data about the impact that that's having, but also to be creative and look for creative solutions and partnerships in their communities.
For sure. And I think on a national level, it's important for organizations such as ours, the Canadian Housing and Renewal Association and the Canadian Alliance to End Homelessness, to work in partnership in all facets of all housing and homelessness issues, because like you said, it's not one or the other. It is a manifestation of poverty and across the board. So I wholeheartedly agree. We have a very quiet audience today, just to let you know. So I'm going to ask another question, and I highly, highly, highly encourage the shy audience to pose any questions that they have. But I know that you can also get in touch with Marie. I assume, Marie, I'm putting words in your mouth, but if you are interested in any additional information about this initiative and about the data that is available, and also how your community, if it's not already involved, can potentially get involved. Is that correct, Marie?
Absolutely. Yep, that would be great.
Yeah, so my question is then, it's kind of on the same line there. So you mentioned the by name lists, and how many communities are currently either working towards achieving by name lists or already at that stage of meeting that requirement currently?
Yes, so we have, again, 33 communities participating in the campaign, and 11 of those have achieved a quality by name list. We have 4 that are just waiting to confirm their data over 3 months, and we have many others that are working hard on that. So it is the first step that communities take in the campaign. So everyone is working towards it, and we're seeing a lot of progress.
Fantastic, thank you so much. And do any of the speakers have anything else they'd, oh, we have a question. Well, I'll still ask this question. Anything else you'd like to add about your experience with Built for Zero that may, assist other communities that are thinking about either joining the effort or looking for some additional information? Does anyone have anything that they'd like to add in that vein?
I've unmuted myself. This is Emily. I can jump in. Is that okay?
Yep.
So I think what's been really interesting is thinking about the plan, do, study, act cycle that Built for Zero has in the context of the word innovation and how to foster innovation and environments for that to happen on teams. So it's what I mean by that is when you say to a group of people who are used to being given very prescriptive or very detailed program models about the kind of work that they're going to do, which one could say that our Housing First programs have very detailed program models, and we fund programs based on those models. But then when you switch it up and you go to the same group of people and you ask them to work on a pilot that has an innovation focus in terms of innovating practice to reach different outcomes and testing those interventions, it can be very challenging in terms of helping people be on that journey from having a very prescriptive way of doing things to being in a more open space. Mm-hmm. And so we have about 4 or 5 pilots happening right now. And at the start of them, I talked a lot about innovation and testing innovations and those kinds of things. And to be honest, I think I pitched it too philosophically and I was not specific enough. So something that we've been doing recently is using the Plan, Do, Study, Act cycle in the context of innovation. So what innovation can we test using that? And I know that may seem really obvious, but giving that language to the different 12 teams that we're funding and helping them understand how that's a structure for innovation helps move it from being, hey, we don't want to try anything because we're not used to, or let's try 20 things at once and not test them, if that makes sense.
Yeah, no, definitely. Thank you so much. And we do have a couple of questions from the audience. So I'll start with the first one. And I think, Marie, maybe you'll take this one, but any of the participants can jump in. So how has Built for Zero considered changing the benchmark for ending chronic homelessness to account for differences in population size, with the context of it would be harder for Edmonton than for smaller cities, for example, to get to that benchmark?
Mm-hmm. Of course, our goal is, zero chronic homelessness, and we identify the 3 or less given, some things that can happen in terms of folks coming from other communities or being discharged from institutions. So really identifying that bit of wiggle room in terms of the measurement of 3 or less. What I didn't mention is that it's 3 or less or 0.1% of your most recent active chronic homeless. So sometimes that's being measured in absence of a by name list through a PIT count. And Toronto is the only community that falls into that category. So if we look at their recent PIT count numbers, their benchmark would be more like 8 to 10. But we are working with that definition of getting to 3 or less.
Great, thank you. The next question is from Saran from Kelowna, and Saran asks, they're most interested at their stage with this work in helping develop their local governance structure regarding CA. And could the speakers describe their governance structure or send a few diagrams of their structure with the slides? And that's their question. Coordinated access, sorry, yes.
And I'm going to just jump in here to say we actually have a document under coordinated access on our website that is pictures from communities across Canada and the US, the pictures of their coordinated access systems, because sometimes a picture is a great, is a good way to give a visual of how a community is set up. That may not speak entirely to some of the governance or committee structures that are in place, so I would let folks speak to that. But I did just want to point out that if you're looking for pictures of coordinated access systems, we have a ton of those in a document on our website.
Great, thank you. And did any of the other presenters want to take that on in terms of what governance structure they've taken on?
This is Emily. I referenced the governance structure of our different committees on the slides. Yep. So that would be our holistic governance structure. And then related to coordinated access, we do have the Housing First Advisory Council, which is made up of the EDs and CEOs of the agencies we partner with.
Great, thank you. And Michelle or Lori, did you want to respond to this one as well?
Yeah, it's Michelle here. I did touch upon it and did mention that we do have a local coordinated response steering committee, and it's made up of EDs from those homelessness serving agencies throughout our community.
Great, thank you. The slides should be available for download right now through the control panel. And if you do not see them, they're going to be made available after the webinar with the recording on the CHRA's website. So I don't see any other questions coming in, just a couple of thank yous to the presenters. So I'm passing those on to you. And as we are pretty much at the end of our presentation time or webinar time for today, I'd like to thank all of you for participating, the audience for participating, as well as to thank our speakers, Marie, Lori, Michelle, and Emily for participating in the webinar today and for providing more information on World Homeless Day around ending chronic homelessness in Canada. Like I said, today's webinar recording will be shared on CHRA's website in the coming days, and you'll also be emailed a survey about today's webinar that will help us here at CHRA plan future webinars, so I'd encourage you to respond to it. And one final thing, this is more an advertisement for a program, but it's an advertisement for the Housing Professionals Mentorship Program, which is accepting applications for mentors and mentees until October 31st. And the program is for anyone working or studying in the housing and homelessness sector in Canada, with more information, including my contact details, available on CHRA's website under programs. So I'd like to thank everyone again, and thank you to the speakers, and I hope you enjoy the rest of your Thursdays. Thank you.
Thanks, Dominica.
Bye.
Bye.